I decided to try IDD therapy because I'd gone through several different types of treatment, which were more, manual type massages and so forth for 2 herniated discs that I had in my neck. Got some relief, but not enough, and just kind of did some experimentation on my own to look around and research on Google, and heard about this type of treatment. So I Googled IDD therapy, and that's how I found the Disc and Spine Center. I just moved back here from New York City, so I was kind of looking for someone in the area. And that's how I found you guys and gave it a shot. Definitely had one doctor say, you could have the disc replaced and have surgery to do that when they go through the front of the neck. And I was like, I don't think this is that serious. I mean, I was in some pain, but not to the extent that I think that could warrant surgery to that degree. But I learned every doctor kind of knows how to prescribe what they do. And so they make your symptoms fit their diagnosis. And so sure, I could go down that path, and it seemed much more risky, but I'd much more try to do more non-invasive treatments first. So that's why I came here. When I first came, I was probably at a pain level of 5, I'd say, out of 10. Through the first few treatments, I didn't see much of a difference. But over time, I would say after probably about 15 different treatments, I started noticing that the pain was gradually going away, and now I'm probably down to like a 1, if anything. So definitely saw a lot of progress, and the staff here was great. Initially made the injury that caused the problem actually when my neck was really stiff from kind of tweaking it, lifting weights, and then I went and played golf, and golf exacerbated the problem, and I think that's when I herniated the disc the first time. Mm-hmm. So golf was definitely something that aggravated it, which was not something that made me very happy. So luckily I've gotten to where the pain level's pretty much gone, and I can play golf as much as I want. So I would say I'm back to fully doing everything that I was doing prior. For anyone that's contemplating going more down the aggressive end of the spectrum and thinking of surgery, I would just strongly recommend to try all the non-invasive, the more conservative approaches first, because surgery is irreversible. And I'm sure there's many great doctors everywhere that are doing what they can, but I've seen firsthand people that I know that have tried surgeries, and it seems like it's a quick fix, but I think the invasion of the body can have knock-on effects that are hard to mitigate later on, versus going more conservative treatment, where you're actually just trying to aid your body into healing itself. And I think that's what this kind of therapy does, which is just really understanding the problem and then really just helping your body heal itself, instead of someone going in with a scalpel and trying to correct it with modern practices. So I would always try to err on the side of caution. If you exhaust all these opportunities, then maybe you consider it, but I would never do that as a first, second, or third course of a treatment. I think IDD therapy is great. I had probably 20 plus treatments, and my pain is pretty much completely gone, so very happy.